people who got told it was just anxiety, what was it? Cancer. I had anxiety and tinnitus for months on end, not knowing why. My labs looked good. They just thought I had anxiety. And the cancer diagnosis from an emergency visit. Post-treatment, surgery and chemo, the anxiety went away. The tinnitus went away. Sure, and new anxiety emerged, of course, because cancer is scary, but it wasn't like the daily feeling of hyped-up anxiousness I'd felt before. Anxiety was a cancer symptom that led me to find out the truth that I had cancer. Story 2. ADHD and CPTSD. The NHS thinks literally every mental health problem is anxiety and depression and jumps to put anyone and everyone in SSRIs and CBT as a result. It's lazy and dangerous. I've been clearly describing the symptoms of both conditions for a decade before giving up and going private. I'm much less anxious since treating the conditions I actually have rather than just the symptoms. Story 3. Celiac disease. I retched through the particular violence every single day for 10 plus years and saw countless doctors and specialists, and everyone, except for my current doctor, dismissed it. Most said anxiety, and one I swear to all things sacred and profane said something to the effect of, "Since you're overweight, is that really so bad? Is my anxiety an issue? Sure, I'm a woman living in 2025, of course, but also maybe the fact that the comfort food I turned to was essentially destroying my body in multiple different ways." Story 4. I was having horrific leg cramps that would come and go. I was at work in a group home and couldn't leave unless someone came to relieve me. Panicking, I called my boss. Shouldn't have even been there because I was sick with a flu and a stomach sickness, but back then I was a pushover and came anyway when I was begged to. The manager said he was on his way and that he had called an ambulance for me. I'm certain he told them I was either faking it or just having a panic attack because that's what they said I probably had since the pain had temporarily subsided. They hemmed and hawed and said they could take me to the hospital if I really wanted them to, and they were very dismissive. It made me feel crazy, and when my manager got there, I somehow managed to drive myself home. If I hadn't then gone to the ER a few hours later, I might have had irreparable damage. After being unable to keep even water down while I was sick, I had deliriously taken almost a whole bottle of Tums and spiked in calcium. The unbearable pain in my legs was basically potassium cramps and steroids because the calcium messed up my entire system. It didn't help that I still had the flu and pneumonia. All in all, I was in the hospital for a week and could barely walk for another month. My manager would still have argued it wasn't that bad, even if I had told him the pain was so bad that they gave me Dilaudid, which is not something they hand out like candy. Story 5. I had anxiety about the pain caused by an undiagnosed ear infection. 1 year, 2 rounds of physical therapy, 10 visits to the psychotherapist, and 1 10-day course of amoxicillin later, the musculoskeletal pain caused by anxiety in my neck is almost gone. All at once. I felt like I was dying and thought I might have neck cancer. The physical therapy was still necessary, and we're working on the complete other side of my body now, but that ear infection didn't show itself until I was already on antibiotics. Story 6. I've had symptoms since I was about 15, and my primary care doctor wanted to prescribe me a medicine for anxiety. Finally, in 2019, when I was 24, I was desperate because I was feeling so off. I begged an ER doctor to take me seriously, and I had CT showed an abnormal amount of fluid around my frontal lobe. A referral to a neurologist also resulted in her telling me it was just anxiety. Again, I begged and cried that I wasn't crazy, and she gave me a referral to a neurosurgeon. Finally, this neurosurgeon listened to me and said he thought I had pseudotumor cerebri and, as a cherry on top, found a small aneurysm on my MRI scan. He then referred me to a vascular neurosurgeon who performed a spinal tap and a cerebral angiogram. Those tests confirmed that I do, in fact, have pseudotumor cerebri due to narrowing of the ventricles in my brain, and that I have a very small aneurysm that doesn't need to be clipped right now. So, yeah. All those times people called me a hypochondriac and a person who thinks a headache is a brain tumor, it turns out I did have something wrong with me that makes my body react like I have a brain tumor. Story 7. I had an upper respiratory tract infection that reactivated my childhood asthma. I kept describing to doctors how I would wake up in the night with a horrible dry cough and being unable to breathe. After 2 visits to the clinic and being told it was just anxiety, that I should focus on calm, deep breaths and taking breaks from work, I finally went to the emergency room. Despite all the deep breaths I was trying to take, it felt like I was breathing through a straw. I seemed black and my lips were blue. I got some medicine and I was right as rain. Now I see a pulmonologist regularly and take a daily inhaler. Story 8. I have AV nodal reentry tachycardia. I would get these crazy spikes in my heart rate that would generally last from 10 seconds to a few minutes before resolving on their own. I'd feel anxious, need to walk and pace, and would feel tired afterward. Because the episodes were so short, there was no real way of diagnosing anything. Most doctors I saw would say it sounded like a panic attack or generalized anxiety. It wasn't until I had an episode that lasted over an hour and had to be given adenosine. Thank God I got a paramedic and not an EMT because it would have been a defibrillator instead of a chemical. That I got a real diagnosis. I had an ablation about 12 years ago, but it has returned over last year, so now I have to have another. Story 9. I have a congenital heart defect. To be fair, it took a full angiogram to find it, and the cardiologist was like, well, it probably won't end you. It put me on beta blockers for life. My occasional panic attacks became daily for a while. Then my wife said, "Hey, I know this is scary, but for God's sake, you're still here." So I started going to a gym and working out harder and harder with the idea that at least there would be a defibrillator there. Lol. I'm still here. And now when I get the weird pause and thump heart palpitations, I just ride them out, knowing that they really are basically nothing. Story 10. Felt like I was always sick as a child and quite frequently sick as a young adult. My symptoms were a runny nose, congestion, cough, earaches, a sore throat, and fatigue, but never a fever. I had multiple ear and sinus infections diagnosed and treated by my pediatrician, but my temperature was always 98.6 degrees Fahrenheit or lower during a sick visit, so many times I just never went to the doctor and did my best to power through cold, flu, and allergy symptoms on my own. The lack of a fever to almost every medical professional, teacher, relative, boss, or colleague I encountered to think, at least initially, that I was malingering or overly focused and unnecessarily worried about my health. I was also told many times that my symptoms were a result of seasonal allergies, should be treated with over-the-counter medications and more rest, and couldn't be that bad because I didn't have a high temperature. One time in middle school, I had the worst sore throat I ever experienced. I described the feeling as having a bottle cap jammed into my soft palate. The school nurse told me to drink more water and called my mom to let her know that she was sending me back to class, but my temperature was only 99.9 degrees Fahrenheit. Since I never ran a fever, my mother decided to pick me up and take me to the doctor, where it was determined that I had a scarlet fever. Another time in college, I woke up with a swollen nose. It burned and ached and felt like I had been punched in the face or had swum in a highly chlorinated pool. It was alarming to me, so I had it checked out at school. Again, I had no fever, but after being questioned about the possibility of it being an STD, which would have been impossible, or an intoxicated injury, which was more probable but not at all likely in this instance, they finally treated it like an infection and gave me antibiotics, which thankfully cleared it up. Then in my late 20s, I got really sick. I had a cough, an earache, and I was just exhausted. I worked as a paraprofessional and had never taken a sick day, but when I needed to take 2 of them while not actively running a fever, I had to go to the doctor. They looked at me like I was a schmuck for coming in for a cold or allergies, especially when my temperature only read 99.9 degrees Fahrenheit. It turned out I had pneumonia and a double ear infection. It wasn't until I was 30 years old and had my 3rd sinus infection of the year that my PCP decided I should see an ENT. Hearing my history, he ran some tests that determined I had an immune deficiency that makes me susceptible to certain types of bacteria, as I do not make antibodies for them. It turns out that many people with immune deficiencies have a diminished fever response, as I appear to have. I've been told my whole life that I couldn't be that sick or that it was all in my head, so when I learned that there was an actual reason, I felt like crap so often. I was vindicated and validated. Story 11. I suffer from MCAS, VEDS, POTS, lupus, sleep apnea, and severe GERD, caused by the bottom third of my esophagus becoming non-functional. My stomach actually swells up at the entrance to make up for this, which I found out during a swallow test this past March. The combination of MCAS-induced anaphylaxis and a POTS episode is particularly difficult. It's not that I can't breathe because I'm panicking. I'm panicking because I can't breathe as my throat is closing up. I can genuinely have dangerous reactions to myself sometimes. This, combined with actual burns on my throat from the GERD, has been an interesting experience. There was also that one random time school nurse said I was just having a panic attack. Then the school secretary called 911 because I was unresponsive outside while waiting for the bus after our friend ran back inside to get help. I wasn't a panic attack. It was a seizure. I haven't had one since, and I'm very happy to say so, but things got very intense that day. In my mom's case, she had a type A and type B aortic dissection that went all the way through her legs in 2012. They let her sit in the waiting room for 8 hours. Funny enough, she wasn't even panicking, just in extreme pain. We were on a family bike ride for Mother's Day, and she thought she was having a heart attack. She figured, people survive those all the time, I'll go to the ER and be fine. Then she had back and flank pains too, and thought, kidney stones and a heart attack at the same time? Man, today is just not my day. We finally did a CT scan 3 hours after she was admitted, 10 hours after she walked into the ER, which she drove herself to, because she was screaming in pain and they had given her enough Dilaudid to terminate a large horse, and it wasn't helping at all. Internal wounds meant none of the IV medications was being circulated. Story 12. Just is an offensive word. Anxiety is more common than depression, and naming an emotion isn't insulting at all. As long as anxiety exists for the person suffering, further consultation with a mental health professional is the best way to ascertain which, if any, anxiety disorder is most likely. If not an anxiety disorder, there are an almost infinite number of mental health diagnoses for which anxiety is a symptom. If a person is in emotional distress, stating that any mood is just a mood suggests that the idiot with poor communication skills will actually suffer more in the long run as a result of their own ignorance and willingness to trivialize a well-known and crippling emotion that needs to be addressed more and judged less. Excuse my own crappy grip on communication right now. I'm suffering in an unprecedented situation, and I wish someone would tell me I'm just anxious. I'll give them a first-hand experience of major anxiety, with pleasure. Story 13. I have hypoglycemia, but basically it's metabolic instability caused by going through refeeding syndrome. It also looks like I have Eagle syndrome, as there is a long spike in my neck and throat that could be irritating the vagus and other nerves. I can flick the spike and it causes pain to spark down my chest and half my face to start tingling. If I happen to move my head the wrong way while I'm hypoglycemic, my pulse will drop to 40, and my oxygen saturation will drop to 70%. It only lasts for about 20 to 40 seconds and then goes back up. It'll also happen if I talk too much. And I realized the pain I was feeling at the back of my throat was the spike rubbing against the base of my tongue. Even I thought it was anxiety. Story 14. Which time? On the mental side, I have ADHD. I've also had a bunch of symptoms from a post-viral infection. Gastroparesis that turned into severe IBS due to SIBO. ME or CFS. I'm being tested for autoimmune disease now. My HPA axis and adrenal glands are messed up, so I have no hormones and cortisol that's sky high all the time. This is why the insomnia, anxiety, heart racing, and mood swings happen. I hope I don't get cancer soon, because I haven't found a gynecologist who will take my lack of a period for 6 years seriously yet. If anyone reading this doesn't have a natural period, go to the doctor now. Look at the numbers on cancer risk. Story 15. I have Ehlers-Danlos syndrome. I started going to the doctor with symptoms at 17, but I was finally diagnosed at 47. When I finally got to see a specialist, my GP literally said, "What's the point? You do know it's incurable." So I had to fight for it. They told me that if I had received specialist physical therapy just 10 years earlier, I wouldn't have ended up so disabled. I'm 54 now. I had to move on because I'm not going to let it ruin the rest of my life, but I will never not be angry. I'm going to start getting involved in an organization that fights for women's health here in the UK as a way to channel my rage in a positive direction. Story 16. Now, my favorite question. A couple of years back, I started having involuntary muscle movements that began as just random head and neck tics and then progressed to my whole body. At its worst, I often describe it as my body preparing for an audition for The Exorcist. Eventually, I got in to see a neurologist who told me it was just stress and that I needed to calm down. It wasn't just stress. Shocker, I have functional neurological disorder, which I had confirmed after I diagnosed and treated myself. Now I barely twitch. Story 17. My vision started getting blurry a week after I got home from the hospital. I told my uncle and my boyfriend at the time, and they both said it was just anxiety, because I was having some mental health issues. My vision kept getting worse, and I was getting massive headaches, unable to move for periods of time. It got so bad that I couldn't drive and had to basically force my ex to drive me to the eye doctor. I went in there sobbing and told the receptionist I thought I was going blind, which caused a scene. They took me in right away. It turns out I was having a super rare side effect from my new medication, and it caused my eye prescription to go from -6 to -9 in 2 weeks. The doctor said this had happened to only 3 people ever documented. She gave me new contacts matching the new prescription and advised me to get off the medication. Within a week, my eyesight returned to normal. Story 18. I have a sensitivity to caffeine. I put on some weight, which increased the stress in my system, and caffeine would push it over the edge. I found out the hard way that the day I had a cup of coffee and shortly afterward had a racing heart, sweaty palms, tremors, and a feeling of impending doom, all of it. Lost a bunch of weight and I'm much better with caffeine now. P.S. Chocolate also metabolizes into a substance that has similar effects to caffeine. If you find that having caffeine and chocolate leads to anxiety, try cutting down on one or the other. And if you're carrying a few extra pounds, consider losing some of that too. Story 19. My son had his first day of school today, and last night he developed an excruciating headache at bedtime despite being hydrated, well-rested, and acting fine all day. I was 100% sure it was anxiety about starting middle school and told him as much, as he was getting progressively more and more worked up. So I went to his room to try to help. I was holding an ice pack over the back of his neck and doing deep breathing exercises with him, telling him he'd feel better if he could just relax. Suddenly, he bolted upright, ran out of the room, and began to retch at an exorcist level. Unbeknownst to me, he had decided to eat some questionable leftovers earlier in the day, and his headache and body aches were entirely from food poisoning. I felt better almost immediately upon retching and showering, thank God. I feel awful that I didn't believe him, but I'm very glad that I went in to try to help anyway. Story 20. I have CPTSD. I've gone from ADD, ADHD to major depression to social anxiety to generalized anxiety to a mix of all three and then possible bipolar disorder. I finally settled at PTSD. I have a few disorders that somehow cancel each other out, so it was a really long, difficult road to go down. I'm sure it'll change again because my doctor is currently convinced I might be bipolar, but needs a psychiatrist to see if the complex PTSD is causing the potential mania. ETA, this all started at 7 years old. Lol. The ADD, ADHD thing is hilarious. They said women only get ADD until I was 18, and then they said my brain is what's hyperactive, so it's ADHD. All three anxiety disorders were back-to-back from 18 to 24. PTSD was at 26, and it was upgraded to complex PTSD as studies were completed and the DSM was reworked. Now at 34, they want to get back to bipolar. CPTSD literally covers all those symptoms, so I just say that and ignore everything else until it's official and I get put on meds. Right now it's quetiapine, which is a schizophrenia and bipolar medication, and I'm definitely not schizophrenic. Story 21. I have supraventricular tachycardia. I was put on anxiety meds anyway, and it totally numbed every emotion, turning me into a zombie. I still have anxiety, but my heart was still going over 200 BPM while I was trying to get it diagnosed. My husband actually had to yell at the doctor to run some tests because it was so concerning. That's how I finally got a diagnosis. The ablations didn't go well because I have a congenital shunt in part of my aorta. During the first ablation, they didn't bother to work around the shunt, and that's when I found out about it. It cost me $12,000 for a, whoops, we didn't scan beforehand, good morning. I got a different doctor after that. During the second one, I woke up screaming when they were taking the cables out of my upper left brachial area, where they had to go to get around the shunt. For the third one, they kept me under harder, but they nicked the left brachial arteries, the same ones that woke me up during the last one. Shockingly, I had the exact same operating room team. I ended up with internal wounds that almost ended me. The clot went from behind my lungs to behind my stomach. I couldn't breathe and started turning cyanotic. My venous system is really messed up because of the aortic shunt. I refuse to do a fourth. I'll just take medication, thank you. Story 22. During the lockdown, I developed a fear that made me believe that anyone I didn't know was covered in germs. This got worse in 2021 when I got an RSV in the same week after I went on a small trip to a large city. After that, I didn't leave my family's property for 6 months. Most of my family lives on the property, and they were the only people I trusted. I had to stop working for a while because I'm a psychiatrist, and I didn't think it was fit to help anyone while in that state. Even now, I'd rather do telehealth appointments with convicted violent offenders that sit in a room with someone I don't know. I'm getting help for it, and I even went on vacation last month. If you're enjoying the video, don't forget to hit that subscribe and like button for more videos like this. Story 23. I've had anxiety since I was 17 and am on SSRIs, but one day I decided it was time to do something about it for real. I started therapy and got into meditating and breathing exercises. I really started to see huge improvements and was finally able to understand my emotions and how my body reacts. But I still felt like something was off. Even my therapist told me she didn't think she could help me anymore. So I decided to see a neurologist and describe what I thought were panic attacks. She immediately pointed out it could, in fact, be tetany symptoms. I did some tests and it turned out that it really was tetany. It was caused by an extreme vitamin D deficiency. She put me in a high dosage for a month and also prescribed me some calcium and magnesium. I have to say that I've never felt better in my life than how I feel now. I'm still on my anti-anxiety meds, but I was able to decrease the dosage and I have zero panic attacks whatsoever. I plan to go off on the meds completely. I'm not saying it was only a vitamin D deficiency that caused the problem because I think my therapy was a crucial part of my recovery. But for me, it was a great reminder that our mental problems are usually way more complex than we think and that we should never ignore the signs that our body gives us. If you feel that something is wrong, maybe it's because something is wrong. Story 24. I have an adrenaline reaction to Novocaine. Some people get Novocaine, like before a dental procedure, and it makes their heart and start pounding and their fight or flight response kicks in. It can be genetic, which is the case with me. My grandfather had it, and he was a rough and tumble guy who later said it was one of the most terrifying things he'd ever experienced. I got it several times before wisdom tooth extractions. I had my wisdom teeth taken out one by one during separate appointments because they came in at different times and several of them got infected, so they needed to come out more urgently. He gave me Novocaine, and several times I had that reaction. It made me feel like I wanted to jump up and run a marathon or punch someone in the face. The staff then left me alone in this state for a while before they finally went and got my mom to talk me down. Occasionally, they had to give me oxygen through a mask and wait it out, which definitely helps. I hate going through medical procedures where the medicine makes you feel weird like that. But my dentist, whom I no longer see, was really dismissive and just said I was anxious. I said, no, I've had this done before and I was calm until you numbed me. And I know this is a common side effect. It's really hard to advocate for yourself when you feel anxious out of your mind like that, but I did. Story 25. I have ADHD, depression, fibromyalgia, PMDD, and subclinical anxiety symptoms. The anxiety was the surface level. Everything else was about unraveling the layers of the onion. Even though I'm not diagnosed with an anxiety disorder, it's one of the pills added to my regimen for treating ADHD and depression. When my symptoms of the two get worse, so do my anxiety levels. They feed on each other, so adding the blue pill to the mix makes me feel much better. When I was younger, they treated me only for anxiety symptoms or depression, never realizing there was something below the two that was causing them. Story 26. Hashimoto's hypothyroidism. Some people have earlier symptoms, and by that I mean my TSH, thyroid-stimulating hormone, the signal your brain uses to tell your thyroid that your body needs it to make more thyroid hormone. Levels were technically still in range, but for years had been getting closer and closer to the top of the range. As that happened, my anxiety got worse and worse. Eventually, my social anxiety was so bad I rarely did social things at all. It became almost totally debilitating. I gained weight after having a fairly steady weight for many years. My depression was much worse than normal. I was so tired. All my symptoms were attributed to anxiety or depression or ADHD, despite me having had those already since I was a teen and never having been like this. Some people can have really out-of-range TSH levels and not have symptoms yet, but we are all different. It's simply a signaling hormone and a complex hormone signaling system, which is going to have a lot of variability from person to person. I learned that if you're not totally average, good luck. My levels were finally officially out of range, and they tested me for thyroid antibodies. Yes, it turned out my body had labeled my thyroid an invader and had slowly been trying to terminate it for years, so it was less and less capable of providing my body with the amount of thyroid hormone it needed. I found a great endocrinologist who told me my worsened mental health symptoms were likely because of my thyroid problems, which stunned me. She said it's really common in her thyroid patients. She started me on thyroid replacement hormone and I got my life back. I went back to school and got my degree. I had a baby, even had a huge baby shower and opened up all my presents in front of everyone. I handled my baby being born premature and being in the NICU. I've had some gnarly things happen in my family that I'm handling pretty well under the circumstances. I'm growing mentally and socially. I wish there was more education among doctors on people like me who have these symptoms early on or are more reactive to early Hashimoto's. I lost years of my life because it was easiest to attribute my symptoms to my mental health diagnoses. Two things can be true. Story 27. Major heart problems. That's what happened to my mother when she had what looked to me like a seizure. I called 911. She was treated with anti-anxiety meds and sent home. Okay, I can accept that. I have a friend whose panic attacks lead to seizures. There wasn't anything triggering it as far as I could tell, but I also have an anxiety disorder, so I knew that sometimes it just happens. The second time it happened, it was even worse. She got properly diagnosed and now has a pacemaker. It's been a year and there have been no more problems. The first doctor just brushed her off by diagnosing her with anxiety, much like how they brushed off women with a hysteria diagnosis. Story 28. I seem to have had some sort of chronic fatigue syndrome. I had a bunch of tests that all came back negative, including a cardiac MRI and wearing a Holter monitor for an entire month. I was already an anxious person who had taken anti-anxiety meds, so I knew this was different. But my doctor didn't really listen, though they were nice enough to get me the tests when I insisted. It took just over 2 years before I felt normal again and could exercise and engage in strenuous activity without feeling like I was going to pass away. After a while, I started to wonder if it really was anxiety, but the fact that it's more or less completely cleared up now confirms for me that there was something physiologically wrong with me. Story 29. When I was about 12, I started getting really bad stomach and chest pains, especially at school. I told my parents and guardians, and eventually they took me to the doctor who insisted it was acid reflux. They put me on Prilosec, but it didn't help. My parents and guardians started telling me it was all in my head. I told them, yeah, I think it's anxiety about school. They said I just didn't want to go to school. I said, yeah, I don't want to go because the anxiety makes my stomach and chest hurt. Anyways, I ended up going to the alternative school, and while I still didn't like going, it didn't give me nearly as much anxiety. I had to go to the high school building for a test, and immediately upon smelling the building, my chest started hurting, and it hurt until I got to leave after the test. It was anxiety, and it was actually so bad that when I went to my son's kindergarten open house, it smelled like school and my chest started hurting. It wasn't until he got to the second grade that I could smell a school building and not get chest pains. Story 30. I still haven't figured out all of it, but basically, childhood trauma screwed up my nervous system so badly that it's causing dysautonomia and other issues. While the exact method is mostly speculative, like dorsal vagal collapse or cervical instability caused by overactive muscles in the neck and shoulders, that's basically what it seems to boil down to. It's causing pain, fatigue, hypervigilance, gastroparesis, MCAS-like symptoms, orthostatic hypotension, and near syncope. Not only that, but all of those symptoms have made it very difficult to exercise, so through the years, I've slowly lost a lot of muscle tone and became very weak. So the answer is sort of anxiety, but not in the way they meant. It wasn't just anxiety, not the type that anxiety or depression medication and therapy could solve. I'm not saying that they don't have their place, but the issue has become large enough that other things like physiotherapy have become necessary. I think a better answer than anxiety is that CPTSD has had full run of the house. Story 31. I have sleep apnea and I was hitting less than 85% oxygen on average each night. I was also working in a toxic workplace without realizing just how badly it was affecting me. On top of that, I was allergic to soy and almonds, but didn't know it because the reactions were slow building inflammation and muscle pain over time. Since I'm lactose intolerant and substituted with soy and almond pretty much every day, that was an interesting discovery. It took 4 to 6 years to find doctors who would listen and care and whom I could afford. Found a new job and made big changes, and now things are better. Anyway, I still sometimes get anxiety because anxiety is anxiety, but it's not like it was before, and it's not an all-consuming thing. Story 32. So my dad ended it all. 7 months later, I had a breakdown and had to wait 8 months for therapy. By this point, my depression was now wholly fueled by anxiety, catastrophizing everything, hypothetical problems, all of the above. On my second to last session, I had intense fears that I was going to lose my job. The health worker walked through it with me, reassuring me it was just a hypothetical. An hour later, I got called into the boardroom. The manager and HR were there, and they told me my contract was not being renewed, and I would be leaving the company immediately. Most of my anxiety was almost fully hypothetical, except for this one time, where I was right in the money. Being right for once didn't do much for my anxiety. Story 33. I have neurological damage due to an undiagnosed autoimmune condition that prevents me from absorbing B12. Screw the neurologist who saw me crying over feeling like I was losing my mind and did nothing but tell me I needed a psychiatrist. And screw the PA who ran bare minimum tests and came up with nothing when I was shaking so badly I couldn't stand or hold a spoon and told me, maybe don't take caffeine, when I hardly drank coffee. Screw the PCPs that brushed off my low levels as probably my fault because I just don't eat the right things. It took until I was 25 and had irreparable damage to get an actual diagnosis and treatment. I also have anxiety and some mental health issues. To be honest, some of it comes from the medical nonsense I've been through. the misdiagnoses and the misdiagnoses. Story 34. I do have anxiety, though it's tied in with CPTSD. However, after managing mental health for over a decade, I started experiencing new physical symptoms: fatigue, heart palpitations, shortness of breath, and brief periods of blindness. I went to an urgent care clinic and was promptly told to go to the ER after an EKG. The ER doctor tried to diagnose me with anxiety. However, I had a fever and my oxygen levels were hanging around 89 to 90%, which meant they had me in a wheelchair because they expected me to fall over. It turned out my heart had been damaged. Fortunately, it was mild enough to heal on its own. I just had to wear a heart monitor for a couple of months. Story 35. It was anxiety, but I also had severe hypothyroidism, which made everything a lot worse. Spent a lot of time on medication that took the edge off the anxiety, but didn't resolve any of my other symptoms. About a year and a half later, somebody pulled a thyroid panel, and boom, my thyroid was the issue. Once I got that taken care of, the anxiety dialed down enough that I was able to lower the dose of my psychiatric medications. About 15 years later, my anxiety ramped up again. This time, it turned out to be perimenopause, and dealing with the hormone shifts from that dialed down my anxiety significantly. I do have anxiety. That's a real thing that is an issue in my life, but when my hormones go out of whack, it ramps up and amplifies by about 1 billion. Story 36. I have severe migraines with no aura or pain. I knew something was wrong with me, and because no one would listen, I was so stressed I was losing weight. Migraines don't cause weight loss, but the symptoms associated with migraines can lead to it. I had precordial catch regularly and started getting tests because I went to the ER thinking I was having a heart attack. I had symptoms of diabetes and pre-syncope. I retched every morning and had severe GERD, more than normal. I had facial sweating, vestibular symptoms, and delayed vision. Bro, I thought I was disintegrating, but no. I took that migraine medicine and slept for 12 hours or something. It wasn't anxiety, it was stress and migraines. Story 37. It wasn't anxiety at all. It turned out that, digestively speaking, I'm a non-absorber. Guess that's through my skin too, because I don't absorb vitamin D either. My diet back then was high in all the good things, but didn't do me any good. I didn't absorb calcium, vitamin D, magnesium, zinc, potassium, or vitamin K. All of these great things that I've been eating forever for my health were not even helping. I had to take massive supplements for a year to get my blood levels up, and now I'm only on once-a-day doses. It's amazing how my anxiety went away and my hyperactivity toned down once I got the vitamin and mineral levels right. I'm really thankful that my doctor decided to check my levels after I had gotten a third kind of cancer. Story 38. I have primary aldosteronism. I had an adenoma on top of my left adrenal gland. I had uncontrollable high pressure for 26 years. My potassium was always dangerously low. No one could figure it out until my first cardiologist appointment, when she looked at my records and said, "I would bet my life you have Cohen syndrome." She referred me to an endocrinologist, and sure enough, they found a growth in my adrenal gland. Unfortunately, this was all happening during lockdown, and finding physicians and clinics that would even see me, let alone treat me, was almost impossible. I ended up having a bilateral ischemic stroke in January 2022. I had my adrenalectomy in May 2022. I was very lucky. I have very few side effects from my stroke, but it shouldn't have happened. I've been told for 26 years that it was anxiety. Story 39. After a 24-hour labor with my first and only child, I had a hard time breathing and nothing about the delivery felt right, even though I had never experienced it before. I told the nurses I couldn't breathe, and they told me that of course I could, and my anxiety was just too high because I was having my first child. In reality, I had a dangerous infection that was slowly moving up my body from being in labor for too long. It turns out, I really was using my last bit of air to voice my concerns. They did one test and immediately called a code blue to my room, and over 12 people rushed in to save myself and my baby. That experience caused me to never trust medical professionals again, even though we don't really have a choice in life but to turn to them when needed. I had decided a long time ago that I will never have another baby and risk passing away again. Story 40. For years, I was told by doctors that my supraventricular tachycardia, SVT, was just anxiety. At one point, a doctor literally told me I was crazy and full of anxiety because I insisted it wasn't just anxiety, that something else was going on. And one day, out of the blue, I turned white as a ghost mid-conversation and my heart started beating super fast. My dad's wife took me to the ER. They told me it was anxiety and gave me Ativan, then ended up doing an EKG afterward. They said, "Oh, it might not be anxiety. We recommend seeing a cardiologist." Long story short, I told the cardiologist my exact symptoms, when they happen, and how they happen. He told me I was not crazy and said he had a feeling he knew what it was but wanted me to wear a heart monitor for 30 days to confirm. I wore the heart monitor for 30 days and it was confirmed what he thought. SVT. Story 41. While in college, I was told by a walk-in clinic that I was anxious, even though I had a concerning lack of energy and strength. They gave me clonazepam and sent me on my way, despite me telling them I did not feel particularly anxious. When I got sicker, the symptoms almost like a cold, I went to the hospital and they gave me antibiotics, citing my enlarged lymph nodes. They also ran a bunch of scans. Halfway through the course of antibiotics, they called me back to tell me that they thought I had non-Hodgkin's lymphoma. When I traveled back to the city where my parents lived to confirm and start treatment, it turned out to be acute lymphoblastic leukemia. After radiation, chemo, a clinical trial, a stem cell transplant, A few close calls, and a year later, I was in remission. 11 years later, I'm perfectly healthy. Story 42. I had a newly formed vein at the base of my brain, pumping straight from my carotid artery into a system that couldn't handle that much, which was causing my eye to slowly start to bulge out of my head. When I first noticed my eye sticking out, it was only something I noticed as I felt it every day putting on face lotion, so I noticed a difference. My eye doctor told me I was just an anxious person and that everything was fine. A few months later, I made sure to send him a picture of my eye bulging out when I had the diagnosis of what was going on. To his credit, he felt really bad about it. My mom is friends with his wife. I just hope he sat with her for a bit and let it change his approach. Everything is fine now, by the way. I had to get surgery to close off the vein so the pressure didn't snap my ophthalmic nerve and blind me. Story 43. I have vascular Ehlers-Danlos syndrome, autism, ADHD, and anxiety caused by not being believed. I was told my whole life that my joint dislocations were growing pains and that I was being dramatic. I was called a hypochondriac by my school nurse when I dislocated my hip by falling on my butt while tying my shoe. She sent me back to class on that dislocated hip. I got as far as the stairs when the principal found me crying, trying to climb them, and called my mom. My hip was completely dislocated, and they had no idea how I was walking on it. I guess I just got used to walking on dislocated joints. They all eventually moved back in place on their own with a little help from me manipulating them until I felt better. It took me 2 years from the hip dislocation to finally get diagnosed with EDS. Story 44. At this point, I'm not even sure. After some effort, I was eventually diagnosed with iatrogenic panic disorder, meaning a medication caused it. However, many months after stopping the medication, it persists immediately upon walking. Over a period of months, it went from being 100% debilitating, lasting until early evening with constant tachycardia, to about 5% debilitating with a new course of medication that took a lot of convincing for doctors to try. The last 5% has been pretty persistent though. Now when I discuss it with my doctors, they describe it as autonomic nervous system dysfunction, as all that's left is a tremor and an adrenaline dump immediately upon waking that now resolves within 10 minutes. The tachycardia is no longer present at all. This is definitely not your typical presentation of anxiety. Story 45. I had what felt like a heart attack and my doctor was all kinds of worried. This freaked me out and didn't help my anxiety. Finally, an ER doctor said it was probably just bruising from stress-related panic, which was causing the chest pain. They did more tests and they all came back good. Even had a scary procedure where they stuck a thing into my vein and up to my heart. The pain finally just magically went away. And my doctor never brought it up, so I just shrugged and guessed the ER doctor was right. I do have a diagnosed anxiety disorder and agoraphobia, but I'd never had such bad chest pain before. It happened during an extra stressful time. Story 46. It was the other way around for me. Kind of. Growing up, I told doctors that I couldn't fall asleep for hours a night, sometimes 4 or 5 or more, because my mind keeps racing and I can't stop thinking. They told me it was ADHD and gave me pills to make me tired at night. I was on those sleeping pills for over a decade before I was diagnosed with anxiety. They definitely have ADHD, but I don't think it's what caused the insomnia, because I stopped needing the sleeping meds once I found an anxiety medication that worked. I wish I'd found that sooner. I'll never know if adults fail to ask, but what are the thoughts about, or if I just couldn't or wouldn't answer that question. Well, if you like these stories, here's more. YouTube thinks you're going to love this. Catch you in that video.